Let's keep the healthcare pipeline full of quality personnel. That is what UAMS is hoping to do with an extension of a federal grant. Tonight, THV11's Rebecca Brown has more on how this help came right on time for healthcare workers.
It's a big deal. It's nearly $20 million.
Anytime money is involved, it brings excitement, but this joy is bigger than the eye can see because it could help change people's lives.
What this does is it attracts students from rural and underserved communities into medical school, and then it helps those students through medical school and identify primary care as a career that they're interested in.
It's no secret that there's a shortage of primary care physicians in Arkansas, but with UAMS receiving a $17.6 million grant renewal to boost healthcare around the state, Dr. Richard Turnage says it's become quite the game changer.
By identifying students and helping students that we think have a high likelihood of going to practice in rural communities, we identify them early, help them through medical school, and by providing experiences that they otherwise wouldn't have had. And this grant is what provides the funding for that.
The objective for Turnage is to recruit and retain medical students to stay in rural communities in Arkansas, something Dr. Wayne Bryant says helps invest back in communities, but also helps eliminate the wait time to see a doctor.
That travel time can be a lot for patients. Sometimes they don't even do regular follow-ups because there's the distance.
Besides having that sense of familiarity between a doctor and a patient, Bryant says the huge takeaway from this is exceeding beyond big city limits.
Just being able to have that access to care, having that doctor that if you have a cold or you have diabetes management or hypertension, or even if you have a hospital in your area where you can be seen, so you don't have to travel like hundreds of miles just to be seen to get taken care of. And we do a great job here at UAMS, but it also helps like reduce some of the burden too here at our own hospital by having them being seen over in the rural areas.
In Little Rock, Rebecca Brown, THV 11 News.
Rebecca, thank you. And she's included more details about how the grant program works in the digital version of her story. It's at thv11.com.